Hi, my name is Michelle Torres, and this is my informative speech for my online oral communications class. And what I'm going to be discussing is the benefits of medical marijuana. When I started my research, I wanted to look back at when marijuana was first used medicinally. And what I found is that it actually dates back to the BCs. I mean, way back when they were using medical marijuana for medicinal purposes. Um, in my research, I found out that it was added to the U.S. prescription list in the 1850s, and it was actually used to treat a variety of ailments. Alcoholism, opiate addiction, leprosy, seizures. It was used in women for excessive menstrual bleeding, uterine bleeding. It was used for people with loss of appetite. I mean, it just seems like the list goes on and on and on. I mean, it was used for so many things, which just shows, that marijuana can be used for a variety of issues. It's not just like for pain or, it can be used for so many things. Jumping forward about 40 years, I found that in 1936, the use of marijuana took a huge decline. Um, and this is contributed to the fact that aspirin, morphine, and other opiate-derived medications were discovered, and they actually replaced marijuana as a pain reliever. But in my study and finding this huge list of ailments, medical issues that it was being used for back then and now, I wanted to know, were these considered effective? Were there studies done? So I did find studies. I found one that was done in 1980, and it was done testing Marinol, which is the synthetic version of THC, and testing it against smoked marijuana. And in the majority of the patients that they tested this on, they responded better to smoked marijuana. I mean, but for some reason, the government decided to give Marinol the green light instead of marijuana, which is odd because you would think if people are responding better to one thing than the other, you'd want to put more money into researching that, but they didn't. I think the issue is that the government sees, and a lot of people, not just the government, but a lot of people see marijuana as a drug that's highly addictive. I mean, that's just what it's known for. But when I think about it, so is codeine, morphine, other opiate-derived medications. Those are highly addictive. You see abuse with prescription painkillers all the time. I mean, people are overdosing on them. They're dying from them. They're highly addicted to them that they're having to go to treatment, and you see doctors prescribing this stuff left and right. And I'm like, that seems to be more highly addictive than marijuana. Why aren't we making these drugs illegal? It's kind of confusing when you really look at the data and the research that's been done. I also looked at a major study that California conducted, and they actually did 7 trials. 5 of those studies were published. 2 of them are still pending. They put more than $8 million into the study, and the results were that marijuana relieved pain, nerve damage, symptoms from strokes, and other ailments. I mean, there's actually evidence-based facts that this stuff worked. They tested their smoked marijuana with HIV and AIDS patients who suffered from severe nerve damage, and it helped relieve the pain. They tested the vaporizer, which is inhaling smokeless marijuana, to see if it delivered a healthier, low-tar cannabis, and it did. I mean, they did this research, and they have, the studies to back it up, that it was effective. I wanted to look also in my research at how many states have legalized marijuana. And I found that there's actually 19 states that have legalized the use of medical marijuana, which I had no idea there was that many. That was surprising to me. But even though these states have approved it, it's not legalized on a federal level. So that causes a lot of issues. But each state has its own guidelines for how they prescribe it. The majority of the health issues that it's prescribed for, though, are cancer, glaucoma, HIV and AIDS, prescribed to people with muscular dystrophy, people with Alzheimer's, spinal cord injuries, traumatic brain injury, and it works for them. It helps them. And, that's pretty amazing, I think. I also wanted to look at the economic effects. of legalizing marijuana because the health effects and health benefits are everywhere. You can find that research easy, but I also wanted to see how does it affect the states on an economic level. And I found a study that was done in 2010 that said that if marijuana was legalized on a federal level, it could potentially generate billions of additional tax revenue on an annual basis. The researchers came up with this number because and this number was based on the assumption that marijuana would be taxed just like alcohol and tobacco. So they came up with this number, and that's pretty amazing. I mean, I know everybody could benefit from that. So, the state of California was the very first state to legalize marijuana back in 1996. So I was able to find a lot of data on their state specifically about their revenue. And I actually saw that one marijuana dispensary collected $1.2 million in sales tax for the city of Oakland in 2012. That is a huge number from one dispensary. And, another way that medical marijuana could boost the economy is that it would provide more jobs. There's a dispensary in California that employs over 120 people. I mean, that's a lot of jobs, especially when people, jobs are scarce right now. People have a really hard time finding jobs. But, doing all of my research, finding out all this stuff about medical marijuana, I just really wish that the government would choose to support its medical benefits instead of seeing it as an illegal drug. I think this would be an excellent alternative. It's a natural remedy. The benefits to our health, there's very real results out there that show us what these benefits are and how they can help us. It's my hope in the future that the government can pump, some research funds into these alternatives. This as an alternative medicine. I think those funds should be allocated, and hopefully we'll see some changes to that in the future. Thank you.